What's up, you guys? Getting my microphones. About to go live, answer your questions. Hello, hello. Sure, yeah. Cool. Got one more microphone here. Make sure you guys can hear me okay. All right. Click all that in. All right. There we go. So this is kind of a this is a session for you guys. Okay. Ask me anything. Okay. So really, how deep we can go. So I've got about 20 different questions here from you guys that have pre-submitted the questions. So I'm going to try to get through some of these first, and then we'll dive in to answer some of the questions that you guys have. Okay. So. For Angela Flores, for a natural-looking boob job, would you suggest fat transfer or the gummy implants? Well, I think that depends on what your goals are. Fat transfer is great if you want a half cup size improvement, but if you want something more than that, or you need to change the shape of your breast, implants is definitely the way to go. The reason why is because an implant has kind of a round shape to it, right? So it can actually have shaping capabilities to the breast. So people with tuberous breasts, fat transfer is not a great. People that have great asymmetry, implant's the way to go. Fat transfer is great for people that have the space to put the fat and then have fat to take from, okay? So great question though, and I get that all the time. I'm one of the few doctors that does both. I do both fat transfer and breast implant placement, and sometimes I combine the two, right? So we can make some soft curves on the top if we need to with the fat, and then get the general augmentation with the implant. All right, next question. Godfather DeWood, what's your advice on UK surgeons offering boob tight instead of implants? Well, I think body tight is what you're probably referring to, is where they tighten up the breast to kind of give a little bit of a breast lift. And that's different. Tightening the breast and adding an implant is different, right? An implant is augmenting the breast. Body tight or Renuvion, which is or any kind of thermal tightening, is just going to tighten up the breast. So if you're looking for a lift, that might work, but again, a lift is not going to give you that great of a lift, okay? So the booby tight is more for people that are interested in just a very subtle lift. If you're looking for volume, definitely go with an implant. My recommendation is go to a plastic surgeon who can kind of give you a comprehensive approach. Sometimes I do the booby tight, implant, and fat transfer, right, to give you the kind of the best overall appearance. Because that's how I sculpt breasts. That's my passion, okay? Jackie 82015, is a second tummy tuck possible? Yes, it is. Even a third tummy tuck. I've done 3, not my patient, but I didn't do the first 2, but I did the third one and I did it right. Okay, so yes, you can get multiple tummy tucks. Just depends if you have any laxity. Like sometimes I'll have a patient that's lost a little bit of weight, but they got all this extra skin and like, I need to lose this so I can continue to lose weight. And so they we do the first round and then they lose that second amount of weight and then they have a little bit extra and then we go back and we take that too. Okay, not a big deal. And I have done revision tummy tucks on people that have had botched work, where the scar is irregular or their plication has failed and we got to redo the plication. So far I haven't had any of my plications fail, because if you guys ever see how I do it, I kind of double up on the plication. All right. So FYI, you guys that are on TikTok, you can check out my Instagram, drdanielbarrett.com, Dr. Daniel Barrett on Instagram, okay? That's where I get all these questions from. It's a lot more interactive. TikTok is great, but it's a lot of fun stuff we do on TikTok. Make sure you follow my TikTok. It's Barrett Plastic Surgery. And then also, of course, my YouTube is Dr. Barrett. Just Google Dr. Barrett Plastic Surgery YouTube, and you're going to get a plethora of videos. I'm actually thinking about making an app and kind of combining all the videos so that people that are actually interested in getting plastic surgery can kind of customize their search algorithm and their library selection, okay? From Arozo711, roundabout cost for breast augmentation, I'm not too in touch with the cost in my office, but this ranges anywhere in the country from around $6,000 to $14,000. I fall a little bit on the higher side of that, okay? We are in Beverly Hills. I do a lot of work with my augmentations that takes me more time. So I do think it's worth the extra cost. Trust me, I'm in there. We're doing 5-layer closure, 14 different things to prevent capsule contracture. A lot of time spent sizing, making sure you're getting the right size. And of course, the concierge approach that we have here in our office to everything that you need before, during, and after your surgical experience. It's not just, oh, we got your money and then boom, you're gone. We don't believe in that, okay? By the way, if you're interested in consultation, check out my website, Dr. Daniel Barrett, and on there is a virtual consultation, okay? So go to drdanielbarrett.com, go to virtual consultation and you can start plugging in your information and shooting it away, and we will get back to you if you have some more specific questions about cost, okay? What are the best breast implant for a natural look? This is from Jesse Azar 22. You know, I like round implants. There's also shaped implants. I'm not a big fan of them because they can kind of turn and rotate. Round implants partially underneath the muscle gives you more of a teardrop appearance, okay? And then the round, if it rotates, it's not a big deal. Saline tends to look more fake. It's like a water balloon, has ripples on the edges. And if you notice, a silicone implant, see, it has a flat side and it has a round side, okay? That flat side is really nice to hold position here and give you the width, and it stays in place better versus a saline implant can actually kind of bottom out like a you know, kind of like a water balloon in your chest, okay? I'm just gonna adjust this just a little bit better here so you guys can see me. All right, perfect. There we go. Okay, so let's go through some more questions. Do you offer discounts or such for patients who surgery watch on IG? C. Laura 85. The discounts I have for people in law enforcement or in the military, or their spouse is active military or law enforcement. That's the current discounts we have. We also do some, we are building a charity program so that a portion of any of our surgeries are going to go to somebody who can't afford surgery, and they have, you know, a real significant concern, whether it's massive weight loss or victims of domestic abuse. So we do have some charity things that we're kind of putting in the works right now, and we hope to announce that very soon. Do absorbable sutures cause really bad scarring? This is from Jackie 82015. This is her second question. All right. You know, absorbable sutures deep down is totally fine. When you start to put them in the skin, they create inflammation, and everybody's different. Some people heal fine. Some people, I've noticed that they form more inflammation in their scar and hence more scar tissue. So that's why I don't recommend absorbable stitches in the skin. Okay, in the skin, my last 2 layers, I close the breast in 5 layers. And the last 2 layers, I close with a proline suture, which is removed at week 2, and then tiny little sutures on the skin that are like the size of a hair, 6/0 nylon sutures, and those come out at week 1, 5 to 7 days. Okay, and it's important to take those out at that time frame, otherwise they'll leave little track marks. But guess what? Once those stitches are out, they don't cause any more inflammation. Your body does what it's supposed to do and it heals up. If you have absorbable stitches, it sounds nice, you don't have to remove them, but your body has to remove them. Your body has to dissolve that, right? So that creates a lot of inflammation in your incision that can promote some scar tissue more so in some people than others, and that's what I try to avoid. I try to do all the different steps that, you know, can be done to kind of help prevent that from happening, okay? Okay, great. You guys are still here, good. Next question, will fat transfer make my breast seem saggy? Aurora, la la la. No, fat transfer is great. It actually brings adipose-derived stem cells from your body to your breast. It rejuvenates breasts. Even if it's not a huge size increase, any little bit of fat there is a good thing. Doesn't make them ever look saggy, okay? How painful is breast augmentation? Jessica, RCO1, okay. Everybody's different. You know, what you'll traditionally hear is, my breast augmentation was so painful I was in bed for 2 weeks, right? And so I made it my mission to get my patients back to work in 4 days, okay? So I do a lot of rapid recovery techniques. That starts with a lot of preoperative preparation with the appropriate supplements. During surgery, I do a numbing block all the way around the chest, because even though your brain is asleep with general anesthesia, your body will still feel the pain. It's just kind of like if you got a splinter in your finger. It doesn't hurt right away, but then it starts to hurt later, right? It's called upregulation of your pain, and your body does that too. If it were to feel the trauma of that surgery and we didn't numb it up, you'd be in a lot more pain much longer after surgery. So we do all that numbing medicine. We put numbing medicine inside. I also supplement my patients with magnesium and CBD afterwards, so they don't even need narcotics. And that down regulates the muscle tightness from when we go underneath the muscle with the implant. That's the magnesium, by the way. And if you're interested in any of these products, check out my website, Post-Op Recovery. I have, like, if you can't come see me, that's fine. Go to my website, postoprecovery.com, and you can get some of the supplements I recommend for each particular surgery, and it will help you recover like a champ, okay? The magnesium is one, and I don't even make that magnesium. It's a product that's I take every day myself, and it's on it's on my website, Post-Op Recovery is made by Biooptimizer. 7 different types of magnesium in there, which is much more bioavailable than the crappy stuff you get at the CVS. It just has magnesium citrate. Okay, and then the CBD, which also downregulates your pain, and then the dissection techniques that we do during the surgery that helps reduce the pain as well. So how painful is breast augmentation? It just depends on who you go to. If you go here, it's going to be pretty minimal, okay? And it doesn't have to be painful, all right? Learning with fibro. Okay, recovery time for lipo and BBL. Again, in my office, typically, depends on the amount of liposuction, but if it's just a standard liposuction here, and the buttocks, it's about 7 days. You can't sit on your butt for 2 weeks, though. It doesn't mean you can't go to work and sit at a standing desk like I do. And so basically, 5 to 7 days for BBL, okay? All right, next page. Success rate and technique for capsulorrhaphy. What are your thoughts on this? Capsulorrhaphy is when you kind of adjust the capsule, and it totally depends on what we're trying to do. If we have to adjust the capsule, generally we want to go smaller. With the implant, I've had pretty good success. Probably about 75 to 80% of all my capsulorrhaphies are successful with minimal problems afterwards. That was from Carly Hamilton. But Carly, if you have a more specific question about yourself, can you just shoot us a virtual consultation? That's a very specific question. I want to know more detail about what it is that you're trying to kind of figure out. Natalie Karuni, how many women who get liposuction have their fat grow back somewhere else? So it's interesting. It's not like your fat's growing back somewhere else. It's like the amount of warehouses you have in your body. Let's say you have 100 warehouses in your abdomen and you have 50 warehouses in your breast, right? You take out half the fat in your abdomen, now you have 50 warehouses of fat, right? But you still have the same 50 in your breast. So if you eat a bunch of food, your body's these fat cells are going to take the fat, and these 50 are going to take the fat. So where you get liposuction, your body produces, it absorbs less of it because there's just less warehouses for the fat, okay? So think of it that way. It's not so much that fat's going to go somewhere else. It's just the distribution, okay? So the distribution, which is normally a good thing, is where you get the liposuction is where it goes to less, okay? But just means you got to watch what you eat. And I don't recommend gaining any weight. I know that's hard, but it's the truth. Okay, next question, 93, Lucia. Average cost of rhinoplasty, that one varies anywhere from $8,000 up to $35,000. If you have a revision case, those are much tougher. Depends on what you need done. Next question, that Geezer Queen. And 40 in November, what's the most popular anti-aging services for men? I would say Botox, right? Because look, I'm in my 40s. Botox, skincare, that's probably one of the best things. If you have some stubborn areas, a little bit of liposuction works great, and a tummy tuck if you have extra skin. I don't think anybody needs a facelift in their 40s. There's a lot of minimally invasive things I do for a lot of men all the time. We do fat transfer to the skin, we do laser, we do various skin tightening techniques, but it's rare that I'd ever do a facelift on a male in their 40s. 50s, 60s, yes. Okay, Liana, health coach. Can I do fat transfer again if I wasn't happy with the first one? Absolutely. I do multiple fat transfer operations for my patients. Sometimes we take from the abdomen, put it to the breast, then we do the inner thigh, transfer to the breast. It just depends on what area you're thinking, if you have enough fat to take to do another round, okay? Do you accept medical insurance for paniculectomy? C-money, yes, we do sometimes. It just depends on your insurance. Again, Dr. Daniel Barrett, virtual consultation. Submit your insurance information. We can run your benefits, see if it'll work for us to do the paniculectomy. But there's a lot of requirements for paniculectomy because you can imagine a lot of tummy tucks are like, I'm going to bill your insurance for tummy tuck, and the insurance company's caught on for this, right? So it's got to be some real medical reasons, like you're getting rashes, you've had massive weight loss and stuff like that for insurance to cover paniculectomy. Paniculectomy is basically a tummy tuck, okay? Without the plication in the middle. How long does 360 lipo take? Well, 360 lipo means lipo abdomen flanks and lower back, and it could take anywhere from 2 to 3 hours. If that's what your question is, 2020 no face. Okay, Omar Israeli, what is the process for plastic surgeon specialization? Well, in the United States, you got to go to college, you got to go to medical school, and then once you're in medical school, you got to get accepted into a plastic surgery residency. Okay, so it's typically 4 years college, 5 years of 4 years of med school, and then 6 years of plastic surgery residency. There's other ways to do it. You could do general surgery and then get a fellowship into plastic surgery. And then, of course, there's a lot of time spent doing research and really bolstering. It's really hard to get into plastic surgery residency. It takes a lot of effort, energy, and intelligence to match into plastic surgery. For example, there's only 97 spots in the country every year for people that want to get into plastic surgery, and there's about anywhere from 4,000 to 5,000 people that apply for those spots. So it's kind of crazy. How much time can I Do fat transfer to breast area. How many times can I do fat transfers to breast area? Unlimited, really. And then H. Carles, can you get symastia from switching to under the muscle? Generally, when you go underneath the muscle, you can prevent symastia because the muscle has an attachment here to the sternum and keeps the implant over. What is symastia? Symastia is the implants when they touch together in the middle, okay? So when you go underneath the muscle, it's a way to repair symastia, okay? All right, last page of questions here, and then we're gonna go to you guys. T and G, can a travel patient get a mommy makeover and mini BBL in one setting? Yes, but you're gonna need to be out here for about 2 weeks, okay? So mommy makeover and a BBL, that's breast, tummy, and buttocks. I recommend not traveling. Coming out here for 2 weeks, hanging out, we update you to stay, and we can get it all done, okay? You asked another question, will a new breast lift correct previous breast reduction scars? Just depends. If you had the anchor scar, which I can't stand, I can't always get rid of all those scars in the first go around. If you had a lollipop in the past, you're in good shape. If you've had an anchor scar, we can make it look better, but those scars are going to be a problem for us. It might need a secondary operation or laser to get rid of those scars second time around. Interesting question. Again, you guys know the difference between the types of breast lifts and reductions. There is a anchor scar. It has a horizontal component on the bottom. Stay away from that. There's no need to do that. It's an antiquated technique. And then there's a lollipop incision, okay? Incision around the areola, line going down. All right. Okay, this is another one. How many people at your office have gotten plastic surgery done by you? You know, it's a good question. I don't know. There's a few. It's quite a few. But I think HIPAA has to stop me from telling you all those people. Okay, Olympia RB. I had 3 weeks ago. I had a tummy tuck, lower abdomen, right side is more swelling than left. That's a great question for your plastic surgeon, you guys. I get these questions all the time. It's like, I just had a tummy tuck. Is this normal? I'm like, I didn't do your tummy tuck. I don't know what happened, so call your doctor. If you can't get a hold of your doctor, where'd you go to get it? Like, you know, there should be some follow-up there. And that's something you want to look for whenever you're deciding to get plastic surgery. Who can I reach out to if there's a problem? Or if I have questions, right? Because I let people, can you tell this doctor that this isn't normal? I'm like, why am I gonna go bother to tell this other doctor this isn't normal? You know, it's like, you know, it's go talk to them directly. I'm not your attorney, okay? All right, Erica Bonilla, 14. How long after having a baby can I get an MMO? Mommy makeover. Oh, I love the abbreviation. You know, I generally say wait 6 months for your body to kind of get back and relax to its normal state. But I've done some as early as like 3 or 4 months. So if you're really desperate, give me a call, okay? How does a periareolar, I'm a plastic surgeon and that word always trips me up. Periareolar incision affect future breastfeeding in the future? Well, the way that I do it is I make a periareolar incision here, like let's say for breast augmentation, and then I dive down and underneath the gland. I don't really mess with the glandular tissue very much. So I'd like to know if, I like to think that my technique doesn't really impair breastfeeding ability very much, but I have to give you the national statistics because I don't study it at my office. I have a lot of women that go on and breastfeed after augmentation for me all the time. It's kind of funny. Women either get a boyfriend, they get pregnant, or they get married after getting breast augmentation here. I don't guarantee that, okay? But it happens a lot, and there's a lot of women that go on and start breastfeeding, and they're able to breastfeed fine with the implants, okay? But nationwide, it's about 7 or 10% reported difficulty breastfeeding, okay? So just do keep that in mind. If breastfeeding is the most important thing to you in the world, and I do think it's important, don't do any breast surgery, okay? But if you're willing to accept that small amount of risk, then go for it, because if you want breast augmentation, okay? All right. Last question, don't marry is her name. I have polycystic ovarian syndrome, but maintain the weight. Would I be a candidate for tummy tuck and lipo? Yeah, I have a lot of patients that have polycystic ovarian syndrome that I do surgery on. You're slightly higher risk for complications, but as long as you're okay with that risk and we can kind of optimize you, I say go for it if you want to. There are a lot of things that you should look into as to why you have PCOS. My thoughts are on that is that it has a lot to do with our diet. Way too many carbohydrates that we eat, not enough fasting, not enough exercise, not enough health maintenance. That's where PCOS, for majority of PCOS patients, comes from, okay? You gain too much weight, now your fat cells are producing way too much hormones, and it's overloading your body, okay? So it's all about carb reduction, exercise, fasting for PCOS, and staying away from the synthetic hormones that they give you, the birth control that they say helps regulate it, just makes you crazier. The synthetic progesterone in birth control medication causes a lot of problems, including depression and anxiety. So just be aware of that. I understand it's on one side you don't want to get pregnant, and the other side you got to really look what these things do to you, and the people that are prescribing it to you don't always mention that. Sorry for the rant on those things, but I just see that happen a lot. All right, so we're going to get into a couple more of your questions. Does it include liposuction, Net 91? Yes, it typically does. It just depends. We do it a la carte. So if you need a tummy tuck, you don't need liposuction. It's not as expensive, but if you need to do liposuction to get a good result, and I'll tell you, then it's part of that price. Kiana Lacey, would you recommend getting a breast lift and implants at the same time or doing these 2 stages? That's always a good question. The question is, and yes, you can board a plane after a tummy tuck. You can do so probably 2 to 3 days afterwards, but I don't recommend it. Maybe a week for a tummy tuck because you can you're high risk for blood clots, right? If you're going to do that, get on the aisle so you can walk around a lot. All right, so a lot of people say, should I get the implant, then get the lift later? Yes, you can do that. That's the way we traditionally were taught back in residency, but a lot of advances in technique, and if you do a lot of these, you're able to kind of do both at the same time and take 2 operations, combine them to 1. There's nothing wrong with either one of them. It's ultimately your preference. Yes, you could probably get a lot more specific if you split them up, but then you got 2 separate downtimes to get the final result that you want. Bianca Denise, you're welcome on the information on PCOS. Yeah, sorry. I'm gonna bounce back on it. It's so way overdiagnosed. It's like, oh, I got this syndrome and it's all this stuff. It's your fat cells producing too much hormone, okay? You gotta reduce the fat. You gotta reduce the carbs in your body and get healthy, okay? Brow lift versus upper bleph. Eric Wolf, yes. I don't do brow lifts anymore. Look where my brows are, right? They're right at the brow, you know, it's like if I were to get a brow lift, I mean, does that look normal? It looks like you're going around looking surprised. Like that's why Kenny Rogers had that kind of crazy look for a while. Blepharoplasty, fine, take away the extra skin, but rarely is there an indication for a brow lift anymore. I think it's an overdone procedure and it makes people look really fake and overdone. I think low set brows is kind of an attractive feature, okay? Not like drooping your face, but you know, I think it's something it's way too much overdone. Men love to spin. How do you feel about mesh? I avoid it as much as possible. It has its role, but I avoid it as much as possible, and it depends on what you need it for. Hernia repair is very useful. Breast surgery, less useful, and I don't really see major applications for mesh. If you have any other specific questions about where you want to use it, let me know. How to prevent keloid scars after breast reduction. Christine Nguyen, I think it all starts with meticulous technique. When you're doing surgery, closing your incisions very precisely, not traumatizing the edges, not using absorbable sutures in the skin, taping for 4 to 6 weeks afterwards, scar gel afterwards as well, and lowering the inflammation in your body, okay? That's it in a nutshell, but to me, it's like a science. It's like I could write a whole book on how to minimize scarring, and I try to do that for all my patients. All right, we're gonna answer a couple questions. I have lung cancer. Can you tell me what medicine to take? Haka, I don't manage lung cancer patients, but I'm very sorry. My father had lung cancer and it was very devastating. I would make sure you're following up with your doctor about that. Is it possible to go from A cup to B cup? Alexa meow, hell yeah. One of these or a little bit of fat even. So just, again, guys, if you have a specific question of what we can do, submit information on my website, Dr. Daniel Barrett, virtual consultation. Also make sure you follow my Instagram, Dr. Daniel Barrett, and we have a lot more interactive stuff, and you can actually DM us on there as well. It's hard to DM on TikTok. So if you guys are on TikTok, come over to my Instagram, and we'll get back to some of your DMs. But if you want more precise stuff, the website, Dr. Daniel Barrett, and the virtual consultation page, you can kind of submit a lot of stuff. What's your take on local anesthesia for BBL? Skin Queen 2, don't do it. Don't do it. General anesthesia is a way to go for BBL, all right? You want to be awake while they're doing liposuction and then fat transfer to your buttocks. The only reason people do that under local is because they're typically not board certified. Means that they can't go into a surgery center and use a surgery center with an anesthesiologist. So they have to do the anesthesia themselves, which means they have to put a lot of numbing medicine in, and all of that numbing medicine is actually very toxic to your heart and can kill you much easier than general anesthesia. So don't do that. That's super painful, and once you sign up for that, you're stuck. Okay, Pre-Princess 94523. Are there a lot of cons of rhinoplasty? No. Rhinoplasty is great. It's one of the most common procedures out there. There's some people that are not happy with it, and there's a lot of things that can happen that we can't really control. But there's a lot of happy people with rhinoplasty. A lot of models have had rhinoplasty. Giselle, I don't know if you know that. One of the all-time biggest supermodels had a rhinoplasty early in their career, and it made it for her. Will you allow plastic for Wolff Parkinson White syndrome pectus excavatum? I do pectus excavatum, and as long as I get a note from your cardiologist, I'm okay with the Wolff Parkinson White. That's a random question. It's a very specific question. All right, I got to you though. All right, any alternatives to lidocaine that don't burn? Not that I'm aware of. Can you have a tummy tuck after hysterectomy? Absolutely. And depending on where the scar is, we can even go below the scar to kind of get rid of that scarring. Now they do a lot of transvaginal hysterectomies, so absolutely. Are there any procedures I can have to do Mariah Carey's body shape? I don't know. She's pretty amazing. If you find something, let me know. But all right, so let's see. Here we go. Will moderate plus make my boobs look more fake compared to regular moderate? So no. And again, I do moderate profile plus, and I also do moderate. I do some high profile. Generally the high profile is where you start to get into fake territory. Moderate versus moderate profile plus, I don't think is going to really rock the boat in terms of how fake it looks. These are all tiny little minute differences that the average person won't notice. But if you do switch to a high profile implant, you could probably start to notice things to look more fake. And the other problem with a high profile is that they're very narrow, right? So if you have a narrow implant in a particular area, it can put more pressure on a certain bottom part of your breast, so it starts to drop down, more so than someone that's a little more broad, okay? So you want to distribute the weight of the implant nicely, and the moderate profile plus tend to do that better than high profile, you're rolling the dice, okay? Yes, I will be having a location in Costa Mesa. It's not open yet, but right now we are here in Beverly Hills. And we have lots of people that come from Costa Mesa, which is Orange County. We have actually lots of people that come from around the world and in this country. All right, we do every type of procedure. People come, they fly, we get you taken care of in terms of your accommodations. So if you're thinking that I'm in New York, I can't quite come out there for breast augmentation. I had someone DM me today, like, just come out again. We got you. We did your for breast augmentation, okay? We can totally take care of that. You're going to get the best results, and then you fly home, okay? And then we can call, we can do virtual follow-ups if we need to get you taken care of, okay? If you're interested in that, you check my website. You can see more details on that. Dr. Daniel Barrett, virtual consultations will get you there, okay? Got time for just a couple more questions. Can tummy tuck undo if you gain 20 pounds? Hard to say. I recommend not to gain weight, but if you gain the 20 pounds, get back on the horse, lose the 20 pounds, and see what happens. I lost that question over there. Can't wait for my surgery in September. Coming from Yorba Linda. Yay, oh, I'm excited for you. How long is recovery for an arm lift for someone that works a lot, CNA job? Yeah, so an arm lift, that has a big scar here. So you might need to take a little bit of time off. I would say at minimum 2 weeks. And then if you could go back to work on a light duty option, we can write you a note, say whatever you want it to say, so that you could be off work for 6 weeks. That'd be a full healing time for that. Red light therapy was mentioned in post-op care. How long do you do it for, Shiva? I do red light therapy every single day. It helps the collagen, and the blood flow and everything, and help recovery. A lot of the exercise I do also helps my circadian rhythm. But I mean, you can do red light therapy for literally every single day for like 6 weeks after your surgery, and you're going to heal like Superman. You're going to heal like Wolverine, really. So I recommend it every single day. There's a product on our website. It's called LightStim. It's a post-op recovery. It's a product I recommend for you to heal after any surgery. You put the little light, it's handheld, you put it all on your incisions, and it helps you heal, and it helps with pain, believe it or not. And there's also one for wrinkles too. You can put it on your face and it helps the wrinkles. So again, that's post-op recovery. I've got a lot of other supplements on there that you guys, if you really don't want to come see me for surgery and you want some of the wisdom that I've kind of figured out over the past, 15 years or so, go to the website and you can buy little kits that are designed to help you recover, okay? And ultimately follow all your doctor's recommendations, and this is just to supplement that. And you guys, again, if you're interested for more interactive stuff, you guys on TikTok, check out my Instagram, Dr. Daniel Barrett, and you guys on my Instagram, if you want to see fun stuff, check out my TikTok, Barrett Plastic Surgery, okay? All right, we're gonna get one more question. Is a BBL reversible? That's great because that's in the news. We actually did a topic about that earlier in the week. It can be, yeah. So a lot of times we need to just be very careful with how much fat we remove, and we need to do some skin tightening typically afterwards if you don't have a whole lot of good skin quality, okay? That could be either done at the time of surgery with the Renuvion or later with Venus Legacy. Okay, guys, thank you again. You got more questions, we'll get back to you. Virtual consultation page at drdanielbarrett.com. And then always you can reach out to me on my Instagram, Dr. Daniel Barrett. is my name there. And also we have Barrett Beverly Hills if you guys have any med spa questions and other questions for other doctors and other stuff that we do here. Thank you. Thank you guys. Come see. You're welcome. Good to see you.